Picture this. An 82-year-old woman named Ruth is sitting at her kitchen table on a Tuesday morning, sorting her pills into a little plastic organizer, the same way she's done every week for years. She takes a blood thinner for her heart. She takes insulin for her diabetes. She takes a pill for her blood pressure, another for her cholesterol, and something for her joints when they act up. She's careful, she's organized, she loves her grandkids, and she wants to be around for a long time to watch them grow up. And yet, without anyone doing anything wrong on purpose, Ruth is sitting on top of one of the most common and least talked about risks in American medicine. Because right now, all over the country, roughly 100,000 older adults end up in the emergency room every single year because of a handful of very ordinary, very common medications. Not exotic drugs, not illegal ones, same kinds of medications that are probably sitting in your parents' cabinet, or maybe your own. I'm Dr. Olivia, and I've spent years practicing medicine and talking with patients just like Ruth and their children, who call me at 9 o'clock at night, worried because mom seemed confused, or dad's blood sugar crashed, or grandma had a bruise the size of a grapefruit and nobody knows why. I care about this topic because it's one of those problems that is almost entirely preventable. And yet it keeps happening quietly in kitchens and bathrooms and bedrooms long before anyone ends up in an ambulance. So stay with me for a few minutes, because what I'm about to walk you through could genuinely change how you or someone you love manages medications, and it might just keep you out of the emergency room this year. Let's start with the real research behind that number, because I never want to throw a statistic at you without telling you where it comes from. Years ago, a landmark study published in the New England Journal of Medicine looked closely at emergency hospitalizations among adults 65 and older across the United States. The researchers found that close to 100,000 of these hospitalizations every year were linked to adverse drug events. And here's the part that really matters. It wasn't spread evenly across thousands of different medications. Nearly 2/3 of those hospitalizations came down to just 4 types of drugs. Warfarin, which is a blood thinner, insulin, which is used to manage blood sugar, oral antiplatelet medications, which also thin the blood to prevent clots, and oral diabetes medications that lower blood sugar. That's it. 4 categories, most of the harm. And nearly half of these hospitalizations happen in adults over the age of 80, with about 2 out of 3 of them caused not by a rare allergic reaction, but by something much more mundane and much more fixable: unintentional overdosing. In other words, people simply taking a little too much, or the timing getting off, or a dose accidentally getting doubled. Now, why would these particular medications cause so much trouble? It isn't because they're bad drugs. In fact, they're often life-saving. The problem is that they all share something in common: a very narrow window between the dose that helps you and the dose that hurts you. Doctors sometimes call this a narrow therapeutic window. Think of it like adjusting the water temperature in an old shower with a finicky knob. Turn it a tiny bit one way and it's too cold. Turn it a tiny bit the other way and it's suddenly scalding. There's only a small, comfortable range in between. Blood thinners like warfarin work exactly like that. Too little, and blood can clot dangerously, potentially causing a stroke. Too much, and the blood doesn't clot enough. So a small bump or a minor fall can turn into serious internal bleeding. Insulin behaves the same way. Too little, and blood sugar climbs into a dangerous range over time. Too much, and blood sugar can drop so fast that a person becomes confused, shaky, sweaty, or in severe cases, loses consciousness within minutes. These aren't drugs that give you a wide margin for error. They require precision, consistency, and communication. And that's where things start to go wrong. Not because people are careless, but because life is complicated. Maybe someone sees more than one doctor, and each doctor prescribes something without a complete picture of everything else that patient is taking. Maybe a pharmacy switches to a different generic version, and the pill looks different, so a patient takes both the old bottle and the new one, not realizing they're the same medication. Maybe eyesight isn't what it used to be, and 2 bottles that look almost identical get mixed up. Maybe someone skips a meal and doesn't adjust their insulin dose to match, or takes a supplement that quietly interacts with their blood thinner. Vitamin K-rich foods, certain herbal supplements, even some over-the-counter pain relievers can shift how these narrow window medications behave in the body. None of this is really anyone's fault in the dramatic, finger-pointing sense. It's usually a communication gap, a timing slip, or simply the sheer complexity of managing multiple medications as you get older and your body processes drugs differently than it used to. I want to be really clear about something here because it matters. This isn't a story about doctors or pharmacists or hospitals hiding information from patients or some kind of system working against people on purpose. What's really going on is much more human than that. A cardiologist manages the heart. An endocrinologist manages the diabetes. A primary care doctor tries to see the whole picture, but might only have 15 or 20 minutes at a visit and might not know that the specialist down the hall just changed a dose last week. A pharmacy fills what's prescribed, but doesn't always know about the over-the-counter supplement someone picked up at the grocery store. None of these people are failing at their jobs. They're each doing their piece of a puzzle that nobody has fully assembled, simply because modern healthcare is spread across so many different people and places. The good news is that this is exactly the kind of gap that a patient or a caring family member can help close, just by keeping information flowing between all the different people involved. That last part is worth pausing on because it explains why this risk climbs so sharply with age. As we get older, our kidneys and liver, the organs responsible for clearing medications out of our system, often slow down a little. That means a dose that was perfectly fine for someone at 60 might linger longer in the body at 80, effectively acting like a slightly higher dose than intended. On top of that, older adults are, on average, taking more medications overall, which means more opportunities for one drug to interact with another, or for small dosing errors to compound. It's not that older adults are doing anything wrong. It's that the body's margin for error naturally narrows with age, right around the same time that medication lists tend to get longer. There's also a quieter factor at play, one that doesn't get talked about enough. Vision changes, arthritis in the hands, mild memory slips, all completely normal parts of aging, can make the physical act of managing medications harder than it looks from the outside. Reading a small label on a pill bottle, telling apart two similarly shaped tablets, remembering whether this morning's dose was actually taken or just intended to be taken. These are small human moments. But when you multiply them across every day, every week, every month, the odds of a slip eventually catch up with almost anyone. This is exactly why pill organizers, reminder apps, and check-ins from family members aren't a sign of losing independence. They're simply smart tools that account for the reality of how memory and dexterity naturally shift over time, the same way reading glasses account for changes in eyesight. Let me tell you about someone I'll call Frank, a composite of patients I've cared for over the years, because his story captures how this usually plays out in real life, and importantly, how it can end well. Frank was 76, active, sharp as a tack, and had been on Warfarin for atrial fibrillation for about 3 years. He also had type 2 diabetes, managed with a couple of oral medications. One winter, Frank came down with a bad cold and started taking an over-the-counter cold and flu medication to get through it, something he hadn't mentioned to his doctor because in his mind, it was just a cold remedy, not a real medication. He also wasn't eating quite as much as usual because, well, when you're sick, food is the last thing on your mind. A week later, at a routine appointment, his doctor ordered his regular blood test to check how well his blood was clotting, something called an INR, which is standard monitoring for anyone on warfarin. The number came back higher than it should have been, which meant Frank's blood was thinner than intended, putting him at increased risk for dangerous bleeding. Because that test caught it early, before Frank had any symptoms, before there was any bleeding at all. His doctor was able to adjust his warfarin dose, have a conversation about what he'd been taking for his cold, and get him back into a safe range within days. No ambulance, no emergency room, no frightening phone call to his family. Just a scheduled blood test, an honest conversation, and a small adjustment that made all the difference. What I love about Frank's story is how ordinary it is. Nobody was a hero. Nobody did anything extraordinary. A doctor followed a standard monitoring schedule. A patient answered a few honest questions about what he'd been taking, even the seemingly small stuff like a cold remedy he didn't think mattered. And a system that's built specifically to catch this kind of drift did exactly what it was designed to do. That's the version of this story I want more people to have. And the honest truth is, most of the time, when regular monitoring is in place and communication stays open, that is exactly the outcome you get. The scary version, the one that ends in an ER visit, usually happens when one of those pieces goes missing. A monitoring appointment gets skipped, a new medication doesn't get mentioned, or a change in appetite or illness doesn't get connected to the medication routine until something goes wrong. The difference between Frank's outcome and a trip to the emergency room often isn't luck. It's whether the loop of communication and monitoring stayed closed. So let's talk about what you can actually do with all of this, because I don't want you walking away from this video feeling anxious. I want you walking away feeling equipped. The first thing I'd encourage you to do, whether it's for yourself or for a parent or a loved one, is to create one single, complete, updated list of every medication being taken. And I do mean every single one, including over-the-counter medications, vitamins, and herbal supplements. Because so many people don't think of those as real medications, but they absolutely can interact with prescription drugs. Keep this list somewhere accessible, bring it to every appointment, and share it with every provider involved in that person's care, not just the primary doctor. This one habit alone closes a huge number of the communication gaps that lead to these kinds of problems. The second thing is to build a genuine relationship with a pharmacist and to actually use it. Pharmacists are medication experts, and many pharmacies offer what's called a medication review or a brown bag checkup, where you literally bring in everything you're taking, and a pharmacist looks at the whole picture together, checking for interactions, duplications, or doses that might need a second look. This service exists specifically to catch the kinds of problems we've been talking about, and it's an underused resource that can make a real difference. Pharmacists also tend to be far more accessible than doctors on short notice. If you're not sure whether a new over-the-counter product is safe to combine with an existing prescription, you usually don't need to wait weeks for an appointment. A quick conversation at the pharmacy counter or even a phone call can often answer that question the same day. Third, if you or a loved one is on one of those higher risk medications we talked about, particularly a blood thinner or insulin, make sure that regular monitoring is actually happening as scheduled, and that you understand what the target number should be. For blood thinners, that often means routine INR checks. For insulin and diabetes medications, that means regular blood sugar monitoring and periodic blood tests like an A1C. These aren't just routine boxes to check. They are the early warning system that catches a drifting dose long before it becomes an emergency, exactly the way it did for Frank. Fourth, pay attention to the small signs your body gives you, and don't brush them off as just getting older. Unusual bruising, bleeding that takes a long time to stop, unexplained confusion, shakiness, excessive sweating, or sudden fatigue can all be signals worth mentioning to a doctor or pharmacist, especially if they show up after starting a new medication or changing a dose. You don't need to panic over every ache and pain, but these particular signs in someone taking a blood thinner or diabetes medication deserve a phone call rather than a wait-and-see approach. Fifth, be especially careful during transitions. Hospital discharges, new prescriptions, pharmacy switches, and even seasonal illnesses like Frank's cold are the moments when medication routines are most likely to get disrupted. That's exactly the time to double check with a pharmacist or doctor rather than assuming everything will sort itself out. Sixth, if you're helping care for a parent or an older loved one, consider setting up a simple, low-pressure rhythm of check-ins, maybe a quick phone call at the same time every day, or a shared note after appointments. You don't need to hover or take over. Most people at any age want to stay in charge of their own health, and that independence matters. But a light touch of shared awareness, someone else who knows the medication list and knows when the last blood test happened, adds a second set of eyes to a system that otherwise relies on one person remembering everything perfectly day after day for years. And seventh, don't underestimate the value of simply asking questions at appointments. Questions like, is this dose still right for me, given my current weight and kidney function? Is there anything new I'm taking that could interact with this? What symptoms should prompt me to call rather than wait for my next visit? Doctors and pharmacists genuinely want these questions. They're not an inconvenience or a sign of distrust. They're exactly the kind of collaboration that keeps a complex medication list safe over the long run. And here is the one thing I want to say as clearly and directly as I possibly can, because it matters more than anything else in this video. Please do not change, start, adjust, or stop any medication on your own based on anything you've heard here or anywhere else without talking to your doctor or pharmacist first. I'm giving you information so you can ask better questions and notice warning signs earlier, not so you can start making medication decisions solo. Your doctor and pharmacist know your specific history, your other conditions, and your other medications in a way that no video ever could. They are your partners in this, and the goal of everything I've shared today is to help you have a more informed, more confident conversation with them, not to replace them. I know medication management can feel overwhelming, especially when the list keeps growing and life gets busy. But here's what I want you to hold on to. This isn't about fear, it's about awareness. The vast majority of people managing these medications do just fine, especially when there's a system in place, a good relationship with a pharmacist, regular monitoring, and open communication between everyone involved in someone's care. Frank is doing great today, by the way. Still on his Warfarin, still keeping up with his appointments, and a little more careful about mentioning even the small stuff to his doctor now. That's really the whole goal here, not perfection, just a little more awareness and a habit of speaking up. If you take just one thing away from today, let it be this. Medications that keep people alive and well, blood thinners, insulin, and the like, deserve a level of respect and attention that matches how powerful they are. That doesn't mean fear. It means treating that pill organizer with the same seriousness you'd give anything else that plays a starring role in your health. A little bit of structure, a habit of asking questions, and a willingness to loop in your care team when something changes, even something that seems small, go an incredibly long way. You don't need to become a medical expert to manage this well. You just need a system, a few good habits, and people you trust to help you carry it. If this video helped you see something in a new way, or gave you a question to ask at your next appointment, I'd love for you to give it a like, so more people looking for honest, grounded health information can find it too. If you haven't already, consider subscribing, because I'll be back with more conversations just like this one, breaking down real health topics in a way that respects your intelligence and your time. And if you have a parent, a grandparent, or a friend who's managing a long list of medications, consider sharing this with them. Not out of worry, but out of care. Drop a comment and let me know if there's a health topic you'd like me to cover next. I read every one, and honestly, some of my best video ideas have come straight from you. Take care of yourselves, take care of each other, and I'll see you in the next one.